Great. Okay, let's move ahead then. So next up, we have Luke from Within 3. So we've heard a lot of the what and the why, a real kind of call to action already today. I'm hoping Luke is going to dive us into some of the how. And no pressure, Luke, but if you could solve all our problems in the next 30 minutes, that'd be great.
Okay, so I'll see how I go. Can you hear me okay, Jess?
Yes, all good. Thanks, Luke.
Yeah.
Okay, great. Perfect. Well, yeah, I'll do my very best, Jess, no promises. Big task. But thanks very much to Emma and Michael for your presentations. I think what I'm going to be covering is going to be dovetailing on top of what we've already covered. So I appreciate that. And thanks very much to Evidence Life Science for inviting me to present today. Really appreciate it, and great to see some of our Within 3's clients on the call here today as well. So my name is Luke Rogers, and yeah, today I'll talk about how you can add some capabilities without adding workload to your medical affairs teams. So I'll today be talking about some current challenges, and we'll be exploring that. So I have some polls that we'll be going through in a second. Then we'll talk about some opportunities maybe where you can deliver on these capabilities quickly. And then I'll have some case studies to cover as well. So Jeff, if we could launch the first poll, that would be great.
Done. Ready when you are.
Okay, so everybody should be able to see a poll.
Well, there should be the poll button in your toolbar.
Poll button, yeah.
People are answering that, so it's working.
Okay. Great. So the question here is, how busy have your KOL, KE stakeholders been? So the people your MSLs and medical teams are engaging with, your kind of customers, are they about the same as before COVID, busier than before COVID, or less busy than before COVID? All right. So I can't see the results, Jeff. So if you could just bring those up, if you could maybe close the poll.
Okay. I'll end the polling, but basically the quick answer is it's 87% number 2.
Busier than before COVID. Okay, great. So we're showing that our stakeholders that we're engaging with are very time poor, even more so than before COVID, when we see things even then were already busy too. So let's go question 2. So poll question 2. So is how are your field medical MSLs primarily engaging stakeholders in 2021, 2020 so far in 2021? Was it 1, messaging applications? So WhatsApp, Viber, Signal, Telegram, face-to-face, one-to-one video calls like Zoom, Teams, WebEx, Adobe Connect, or for email? All right, Jeff. So when you've got a quorum, please stop the poll and let me know.
Lots of answers coming in. Give it 10 more seconds. So I'm going to end the polling, but the quick answer is 71%. 15 people chose number 3, but I'll share that.
Okay.
Can you see the results on the screen now? I'm apparently sharing.
I can't.
Yes, I can see it.
That's fine. Okay.
Yeah.
Okay.
Great.
71% said number 3, and 24%
great.
people said number 4, email.
Okay, so it's email, which obviously we had before COVID, and now one-to-one video calls. So you're relying on kind of real-time communication. So that's great. Obviously, you're having that face-to-face element with your external stakeholders. Good. Let's go to poll 3, please, Jeff. So that was how were your advisory boards and insight sessions delivered in 2021 and 2021? So is it messaging applications, face-to-face, the live webinar, so everybody on a single call, or using platforms that are over time or asynchronous that allow people to log in whenever? So is it 1, 2, 3, or 4? So again, Jeff, let me know when you've got enough of a quorum.
Ten more seconds. Okay, so 100% of people said 3 or 4, and of that, 3 was by far the biggest answer, with 17 people said 89%. I'll share that now.
Using live webinars.
See that? Yeah. Number 3, 89%. Number 4, 11%.
Excellent. Great. Thanks a lot for that. So yeah, so the live webinars are these ways that we're engaging with your stakeholders. That's great, I think, for the kind of the one-to-one things, but I think the advisory board way of doing things, I think there's a better way to do it. We'll be talking about that as we get later on in this call. So in terms of the capabilities that medical affairs need to be looking at, Alex Bedankov and his team at AstraZeneca put this infographic together from their article they put out last year. So they've identified 7 areas. So it's digital innovation and creativity. So this is about being obviously digital ninjas, as was mentioned before. Data science and analytics expertise. So how to obviously be data scientists as well, so a second hat, and how to analyze and interpret the data. Now, scientific competitive intelligence. So that's a whole nother realm in itself. Health economics, payer and real evidence. So understanding the overlays of the various payer, the data sets from health records or maybe claims databases, things like that. Then you have communications, behavioral change. So that's a lot of your soft skills that's already touched on. The storytelling, which is so important in the medical affairs space. That's really important to have that. Then you have developing leaders to create the future, obviously people who can be promotable and can be the future leaders. And then also the business acumen, so having the MBAs. So as we said, we all know that medical affairs have to wear a lot of hats. It has to be really flexible in the way that they go about things. So it's a big task ahead of all of us if you're going to be recruiting and retaining and developing these future medical leaders. And that's the challenge. So it's about where in this space do we really focus on. You can't do everything at once. If everything's a priority, then nothing's a priority. So where are you going to be looking to select your quick wins? So let's get into chat now, if we can, please. So I'd like you to just say at the macro level, what do you think is limiting the success of you implementing a new capability? If it's a training platform, tool, skill set. At the macro level, what do you think is actually limiting the ability to bring that to bear on your internal teams? So let's jump in the chat and tell me what kind of things do you think are holding you back? Okay, great. So time constraint from Kevin. Internal approvals, the volume of new tools, workload, too many competing priorities, time. Fragmented focus. So yeah, when kind of spread across a range of needs that you have. Can it be used then next month? Can you get relatively quick impact? Yes. Resistance to change internally, absolutely. And we also had another one up here. The volume tools, great. Okay, perfect. Joe says, often decisions need to adopt a new capability. Okay, it needs to be made by global, not the local offices. Got it. Okay, so yeah, I think you've covered a lot of these kind of main areas. Some of the things that I've also put in as well, things like the opportunity cost of your employee time, particularly in the learning phase, be it a tool, skill set, capability, a training area, just the amount of time that they take in that space. And it's all about the relative opportunity cost. So what could they be doing with that time? How many more KOLs could they be engaging with, patients, outreaching with, and focusing on those other more important tasks. And what the risk is here is that they do lose that focus. Okay, so preserving your core values, but also your core functions that kind of Emma was talking about as well. So keeping the main thing the main thing. Again, the time of the development of the tool. So if you, as the manager, if you're the one actually developing that synopsis, that curriculum, your time to actually do that. I mean, you could be doing very valuable things as well with that time too. Or if it's a software, your IT's department time in making that thing, for example. Then there's the utility of the capability and the upskilling. Again, does it have an impact on the business outcomes you're trying to affect? And what you're looking at is two elements here. So there's the training gap. So that's when the person doesn't know what they need to be doing. Okay, so you're trying to get them up that gap and show them what needs to be done, what the new standard or SOP will be. And then you have what's called the implementation gap, and that's will they repeat, will they perform that skill repetitively to the right standard? Will they have the best practice interactions with all of your key stakeholders? Will it always be of that high standard and maintaining those standards? And then you have things like recertification, ongoing time commitments that need to be done periodically as well. That's obviously very important. And the risk is here is those annual trainings create a impact on morale. And then you have your budget. Obviously, it's cost utility. So again, could that cost be used elsewhere in the business for a better impact? Great. The landscape shapes the capabilities you're going to be needing. So we're seeing, obviously, we're all in a digital world. I'm currently in the Austrian Alps. So apologies for not wearing a business shirt, but yeah, we're all working in virtual spaces. So this digital is obviously one of the key drivers, I think, of the capabilities going forward. And now there's what do your customers want? And the question that was put to KOLs is beyond COVID-19. So after COVID-19, would MSLs, should they be using technology, virtual technology to engage? And the answer was resounding yes. Okay, so even your customers post-COVID want to be engaged with in a virtual way. So now that we've kind of mapped out what's out there, we understand the challenges, we've had a kind of, we've got it off our chest, shall we say. Let's talk about where are the opportunities, where can we deliver on this? And we go back to our MBAs, let's look at our action priority matrix. So you've got your impact on the Y and your effort on the X. So what's going to give us ideally something with a high impact outcome with relatively low effort or a relatively low timeline. This is the area we want to be going for, these kind of quick wins, shall we say. And what this definition is showing us that quick wins are not low impact. This is saying that quick wins are high impact. So the terminology quick win often has that kind of low value kind of stigma attached to it. In this particular definition, it's actually having a high impact. A low effort, low impact is actually called a fill-in, as we can see. Okay, and then you've got your other quadrants here too. So this quick wins area is what we really want to be going for. Again, you've got your timelines, you want to, again, show your leadership, you are investing, show your teams beneath you, you're investing in them, and you're giving them the tools to make a faster, higher impact. So if we come back to the Bedenkov and team infographic, where would the quick wins be for this? I'll kind of work through mine, but me personally, I think that it's more on this left-hand side. Okay, so your digital innovation and creativity. Again, digital, there's a lot of tools, there's a lot of kind of platforms that are out there that exist in this space. Then you have data science and analytic expertise. Yeah, you can use external sources for that to kind of train you on that capability or maybe manage that capability for you potentially. Then you have scientific competitive intelligence. Again, you can use other platforms to kind of quickly maybe aggregate that data so you can have that information more readily to hand perhaps. And then potentially health economics and payer real evidence. So more about really understanding the evidence requirements or evidence gaps than necessarily going and filling them. I mean, going and filling them may require large randomized controlled trials or phase 4 studies. So that could be kind of either or. On the right hand side, you've got areas that are extremely worth investing, extremely valuable to your business. You need to be giving your teams business leadership. These things are, if I go back to that previous chart, these are more in this major projects space. Okay, they're absolutely worth doing, but you're going to need to put a lot more effort into it, and the timelines are going to be a bit longer as well. But absolutely worth doing. Okay, so for me, these three over here fall more into that category. Okay, great. Okay, so thinking about it now, I mean, based on what we know, what could a quick win medical capability look like? And it's maybe something that's going to help engage your time poor KOLs, going to give you more insights from your very, as we've shown, you've shown me, your KOLs are time poor. Probably digital. Again, they want to be engaged with digital. We're all working digital. Ideally, something that doesn't require training of your teams. Wouldn't that be great? If you didn't actually have to train your teams how to use a thing, there was no training gap, no implementation gap. It just always worked. That would be great. Or no ongoing maintenance. You don't need to be investing in your IT teams, constantly recoding, updating, upgrading a particular type of platform. And ideally, it always works. If it breaks, then you don't have to be watching YouTube tutorials like for things like MS Teams, which I find myself doing at times. Ideally, fully secure and compliant, because you're in the medical space. You still have these very important requirements that are must-haves. So this is a non-negotiable. Again, no training. Ideally, allowing for full utility of honoraria, quickly deployable or almost instantly deployable. That would be great. Doesn't require business reorganization or changes to your SOPs. I mean, I'd put that on your wish list for sure. And obviously cost effective. It needs to work in relation to them. It needs to be worthwhile doing in relation to the investment behind it. Great. And achieves your business outcomes. All of these things, I think, would go on the wish list of what it could look like. And therefore, from there, automated wherever possible. And the good news is that there are platforms which do things like this, that don't require your team to learn them, that aren't charged by the hour to manage, that do deliver business objectives in a kind of project managed way, that are the most stakeholder-centric format possible to allow all of your stakeholders to participate and be engaged and be heard, that are fully secure and obviously meet these needs, highly user-friendly, and have nearly 30,000 other KOLs and patients that have already used them to date, and works across languages and across time zones. And we're going to use things like artificial intelligence and machine learning to streamline the insights process. Okay, so that obviously is my company within 3. We have been making a lot of moves lately. We actually had one of the largest rounds of digital health growth funding in 2020, and that was published here in the Wall Street Journal as well. So what we're doing with that is we're creating basically a uniquely powerful insights platform. And what we've done is we've gone out and we've carefully selected and acquired 2 companies, one called Vox Analytics, which does things like real world data enhancement and KOL identification and selection. And then Rmark Bio, which is a artificial intelligence and machine learning proprietary company that has a proprietary platform that actually really goes deep into insights and then validates insights against other real world sources that are out there as well. So basically, when companies start using the Within 3 platform, they're going to be able to add in these other kind of wraparound services that are going to add a lot of value to the work they're doing, and basically give you a digital capability that you don't have to, again, train anybody on, work with anybody on, maintain. All of that stuff goes away. And this point here is that it's automated, and that means that it's going to be getting better and better, but at the same time, you're going to have a more reliable platform to work on. I have some case studies to work on, to show as well. And the first is around empowering the MSLs. So Emma talked about this. You need to show your MSLs new ways to engage with KOLs. And a lot of times I hear that managers don't feel that their junior MSLs aren't ready to run their own virtual advisory boards. And a workaround that we've seen, or a way that we've seen it actually put into effect, is what we call a meeting in a box, or it's an MSL KOL engagement advisory board. So we had one client that ran in November 2020 several sessions around ovarian cancer treatment pathways and paradigms. So what they had, it was in the US, so they had 5 sub-regional sessions. So I think there was Florida and South. They had East Coast, like North and New England and New York, New Jersey. Then they had a Midwest, a Central, a Mountain, and a West Coast version. So there was 12 standardized questions. So all of these sessions used the same question or tools or question tasks that were put to the advisors in all of these different areas. And they were typically open text with some multiple choice and rating scales. And there was always an introductory webinar after an initial pre-read period. And basically what it generated was just a huge amount of insightful transcript from each of the individual sessions that, when merged back together, had a lot of statistical weight. So you had the kind of best of both worlds. You had that local touch. So you're empowering the KOLs locally, but when you bring all that data back together, it actually really had a lot of power behind it. But the main kind of reason for this was to create familiarity between the MSLs and those local kind of sub-regional KOLs. And it was extremely effective in doing this. So I advise you all, push this down to your local MSLs, challenge them to use these opportunities to improve the relationships and networks they have. The secondary benefit it generated was a network amongst the KOLs, which they reported back was extremely valuable. So now all of these sub-regional KOLs in all of these areas all have time and connection with one another, which is, again, very, very valuable. The business impact is, as I've kind of discussed now, they created great relationships, very warm between the MSLs and these KOLs, and also they created a network amongst themselves too, and it generated just really powerful data coming out of it. So again, engagement first, insight second. So that's the kind of check down, touch down. And this is the structure they used. So there was an initial 4-day pre-reading period. There was a kickoff webcast, which was done live. So all of the advisors live. And then they used our platform to have the question and answer responding to those stimulus pieces. And then there was a final deliverable placed into the session. I think it was a treatment algorithm for their local clinical context. Okay, and this is kind of how they used it. So it was done over a period of 18 days. And at the end of it, huge transcript was collected and merged back with the others, and there was a large presentation prepared from this. Another case study I have is when you have maybe an under-resourced medical team, but you need insights, and this is true of everybody, and particularly in small pharma and biotech, but I'm hearing this a lot more in large pharma too. I'm hearing the old, we may be a big company, but we're a small team. So I'm getting a lot of that at the moment. So this does apply to everybody. So the example is after initial consultation in August 2020, we had a session in February this year, which would look at novel botulinum toxin type product, which is obviously a very competitive space. That company was a small pharma company. They have a minimal contacts with KOLs and only 3 people in their medical team. With 1 MSL. And they had 13 questions they wanted to ask of these experts, but they didn't really know who they were. And in the end, once they got all the advisors together, they generated a huge amount of interaction, engagement, the opportunity to listen and hear these experts, particularly around scientific evidence gaps was the most responded to question. And they generated, again, 55 pages of transcript. Again, it's all about really understanding the mapping out the market, and the company at the end of it had a really good idea of the go-to-market strategy, what approach they should take in terms of pricing, evidence, and relative clinical benefit in relation to their very competitive space they're in. And they're now planning another session October 2021 once they've digested these results. Okay, so just to see if anybody's listening, this session itself was a great example of engagement, but there are fleas on this. So this one has problems in regards to the timelines. Okay, and this is all around the timelines that company is working to. Okay, so they came to us in August 2020. The session launched this year, so that's 7-8 months gap straight away. And in that time, they had to go and find contacts and contract contacts. Contract those KOL contacts. And then after the session ended in February, they're now waiting till October to digest the results. Okay, this is a very long period of time and problematic if you're that company. So the session itself was a success, but the process either side of it just took way too long. So if you're hunting for KOLs, they were using agencies, they're using partners, publication searches, and the contracting, as we know, is a very laborious process too. And then taking 6 months to look at the results is just way too long. So your business just can't wait for that. And that's really the why for our new structure. So what we're looking to do with our new model is within 3, once we've integrated these elements, the Vox company and this R mark into our overall business, we're going to be looking to drive that down. So we'll be able to offer a platform to our clients that takes it in this case, from 14 months. It's not always that slow, obviously, but we'll be looking to bring that down to several weeks. Okay, to bring that whole process down, in terms of things like handling, contracting, KOL or outreach, if the company requires gaps filled in that space too. So with greater power of understanding of all of this data, when you overlay our service of the artificial intelligence machine learning, you're going to be able to validate the results you take out of it with things like claims data, clinical data, referral networks, clinicaltrials.gov, and look at the other endpoints that are out there too. And this will give you just really greater certainty in decision making just a few weeks after the session ends. Okay, so what it's going to bring really is a frictionless capability, which acts as an extension of your organization. Okay, so there's an integration still ongoing right now, so it's not available as we speak. But once it is, then you'll have a seamless solution that will really push you to challenge your teams of what can be achieved in specific timelines. And all of this, again, is done on top of what your team's doing and doesn't require your team to learn how it works. Okay, and our team will be running this for you. And again, these quick wins can be applied across medical affairs in all of its areas today, across the whole product lifecycle. So my key takeaways today are the quick wins are possible in adding capabilities to your medical affairs function capability suite. They're only quick, obviously, if the business friction, the opportunity cost of time are minimized, and the outcomes are both repeatable and managed so that they deliver specific outcomes. And quick wins don't always have to be low impact. By that definition, they're always high impact. And a quick win with high impact will give your team a competitive advantage. And within 3, we're looking to change the game and make some noise and give your team smarter, faster, deeper insights that are ideally validated and really add value to your work without adding any workload to your team. So that was all from me. Thank you very much. Any questions, Jess? I'm happy to take on.
Perfect. Thank you, Luke. One question from me. I love the Within 3 platform and kind of it offers. Are there any kind of tips that you would share around thinking about a standard advisory board and agenda and questions and how you translate it? Like what type of questions work really well and which ones don't work well?
Definitely. Yeah, so the types of questions that work really well are, even if you're having I see a lot of times people are writing, do you think we should do this? And they've used it in open text format, and they're just getting really weird and wonderful answers. But in itself, it's a closed question. Do you? It's a yes, no. So even for yes, nos, those should be used as a multi-select field. So even if you get 80% saying yes, 20% saying no, that all of a sudden the data jumps off the page and starts to tell the story, and you can use it straight away as well. So things like this will improve your ability to quickly interpret the data as opposed to just a wall of transcript. I mean, a lot of our sessions generate huge amounts of transcript, but a lot of what our team does is actually consult with the clients, tune up the questions like this. So there's actually not so much transcript, but what it is more data that's been visualized, and it speeds up that storytelling element in terms of what stories you're able to extract out of the insights that these KOLs have shared. Another one would be using tools like document annotation. So instead of everybody working in SharePoint and saving different versions, and there's always version conflict, use a platform that allows everybody to use this access and annotate the document at the same time. Things like that really speed up the workflow. We've seen that in publications. We had a company that had a publication that was going through this kind of author review process for about 6-7 months, and they still hadn't finalized it. And then in the end, they used our platform, and 2 weeks later, they had something ready to go. This is the kind of use cases we're seeing too. So kind of give people a deadline, and that's kind of one of the key psychological tools that really do drive great outcomes from our platform.
Great. Exciting times. Thanks, Luke.